Okay, so my name's Amanda Oakley. I'm a dermatologist from Waikato in New Zealand. It's a pleasure to be here. Various conflicts as listed, none of them that are really of note. Some definitions. So teledermatology means lots of different things to different people. Remote dermatological consultation certainly can be synchronous or asynchronous. It can be live, interactive, or store and forward. Or virtual dermatology, meaning the use of a computer. A dermatologist can talk to a dermatologist or another health professional or a patient. So when I began my dermatology, we had the plain old telephone system. We didn't have fax, desktop computers, mobile phones, Wi-Fi, and the coffee was bad. Still is in some places, like my room this morning. Digital technology advancements have been incredible in the last 40 years. So global access to the internet has risen to 59% in September 2021. At least 67% of the global population has a mobile phone. The first phone camera was launched in 2000. That's not really that long ago. So patients and health professionals can easily capture, transmit, and store high-resolution, high-quality digital images. There's been a rapid development of new store and forward portals, systems, and platforms, and enhancement of video consultation software, and adoption of comprehensive electronic medical records. But there are lots of challenges. There's increasing need for accessible healthcare because there are more people, aging populations with multiple comorbidities and complex medication regimens, and there's very few dermatologists, and those who are located in urban centres. In fact, there's not enough primary care health professionals either. And in my institution, we discharge our patients with high complex needs, expecting the GPs to follow them up. But they have waiting lists just like hospitals do. There's lack of personnel and resources. So in June 2023, the search term teledermatology resulted in 1,300 results, whereas it was only 241 when I last tried in 2021. Artificial intelligence and dermatology, 1,212 results, whereas it was 327 at the beginning of the pandemic. There's been an incredible change. But there aren't that many guidelines and standards published. These are they from the USA and from Australia. Some from the ATA in America and the American Academy of Dermatology and a UK National Advice and Guidance Toolkit. The effect of the pandemic resulted in a rapid increase in the use of teledermatology. In my institution, that meant we picked up a telephone. We didn't use video very much, but we had already an established advice and guidance referral system, as they call it in the United Kingdom. So a few organizations got together and wrote out specific recommendations for individual diseases in their own countries. And systematic reviews have been published. The teledermatology system used depends on the health system and its regulations, whether it's a national health system and how it's funded, or whether it's a public, private hospital or private clinics. And it isn't easy to generalize a teledermatology system to another setting. Risks to teledermatology are funding, online security, patient safety, informed consent, cybercrime, conspiracy theories, and the digital divide, among others. So in May 2021, my hospital underwent a ransomware attack. We had no landline telephones. We had no computers. We didn't know who the patient was. There was no documentation, no schedule, no dictation, no electronic prescriptions. But we did have mobile phones, and we had paper and pen. This lasted months. Conspiracy theories abound. we all know that social media is a power of good and a wicked evil. And this is true for dermatology topics as well. We have articles on urticaria, lupus, eczema, psoriasis, showing the extraordinary lengths that trolls and some people with something to sell will go to lie and avoid the truth. So let's look at artificial and augmented intelligence. This is going to make a difference, whether image analysis to help detect and diagnose skin conditions, to compare patient data with an extensive knowledge base with generative AI, for example, to assess the risk of patients with skin cancer, for clinical decision support, and to streamline dermatology in general. It is already occurring. So ChatGPT, for example, will tell you what it does if you ask it, and I won't read out the small print. The virtual dermatologist can be drawn by a machine. Try DALL-E, that's what you get if you write virtual dermatologist. The International Society of Teledermatology is an incorporated society led by a board of directors established in 2003, thank you, Peter, dedicated to advancing the practice of dermatology and fostering international cooperation. We do have an official journal, JAMA Dermatology, and a representative is here, that's Daniel in the third row. We hold biannual conferences, and we have a small audience. And that tells us that despite so many people using teledermatology throughout the world, its relevance as a society has not moved forward over all those years, 20 years. So the Society's board has plans to rebrand and expand to include more digital health in dermatology. Thank you.